At some point, a woman said, I know this is going to sound weird, but I feel like I can hear Mongolian chanting in my ears.
Music, Mongolian chanting is a good one. Yeah.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now, here are your hosts, Dr. Michael Squires and Kevin Ziener.
What better way to kick off Audiology Awareness Month than with a brand new episode of Ask an Audiologist? I'm Kevin Ziener.
I'm Dr. Michael Squires.
Today, we are going to be discussing how to properly diagnose and maybe treat, and I think I'm going to say this right, hyperacusis.
Said it right.
Written by Dr. Maura Chippendale of Chippendale Audiology. I see no better place to start than asking you, Dr. Michael, what actually is hyperacusis?
Yep. So welcome, everybody. Happy Audiology Awareness Month.
Right. This is our month to shine.
This is it. Yep. I hope you can feel the glow.
Yeah.
If you're watching this, you're aware.
It's permeating.
Yes.
It's palpable. The energy transference between us and the video is very much on par.
And I can tell you're going to go schedule right now.
As you should.
Yeah. So hyperacusis. So hyperacusis is something that is not tremendously prevalent. Okay. But when it is something that a patient experiences, it's very bothersome. Okay. So hyperacusis by definition is just an overall hypersensitivity to sound. Not to be confused with misophonia, which is a severe reaction or triggering of by a certain sound. Right? Sometimes like chewing or pen clicking or nails tapping on the desk or something like that. Yeah. Right. So this is hyperacusis. We're talking a global intolerance of loud sounds. And these are sounds that are not necessarily loud to you and me. Sure. This is something that to that particular person feels louder than what it really, really is. Got it. Yep. So that's hyperacusis.
So hyperacusis, I imagine, massive emotional component to it as well.
Yep. Yeah. And we were talking about this a little bit before the podcast. It is very emotional.
Got it.
And the reason it's emotional is because we live in a noisy world, right? And so for some people, it feels inescapable. And so what we need to do is start treatment for these patients and start it very quickly because it really is a process of desensitization. So we want to create a distinction also between tinnitus or tinnitus and hyperacusis. So tinnitus or tinnitus is going to be that sound that nobody else hears that you hear. The crickets, the ringing, the buzzing, the chirping, the bacon frying,
I heard somebody,
it's described.
Dr. Jordan said at some point, a woman said, I know this is going to sound weird, but I feel like I can hear Mongolian chanting in my ears.
Music, Mongolian chanting is a good one. Yeah, I don't know. I could tune into that for a little while.
I feel like I'd be comfortable with that. I'd be like, it's light jazz, so I'm cool right now, but maybe in a month I won't be okay.
You know, we kid about like light jazz, but I have patients that have musical tinnitus. Wow. And so, music that or songs that they haven't heard in 40 years pop into their head and they stay there, and they can hear the lyrics, they can hear all the parts of the band, they can so
that's crazy. That's wild.
Musical ear syndrome.
Okay.
And so different iterations of that. So we're not talking about any of that. Sure. Even though we're talking about it.
We should at some day talk about it, but not today.
Yeah, not on this day.
No, not on October 2nd, Audiology Awareness Month. Not today.
Yes. But soon.
But soon.
Hyperacusis.
Got it.
Yeah. So when we start talking about hyperacusis, we really also have to, like you said, talk about the emotional component because it is a very emotional thing for the patients who are experiencing it, which is why we oftentimes pull in other professionals like psychology and make sure that they are being that the issue is being addressed from that perspective as well. Sure. Because what really kicks in is the limbic system. Right? We've talked about it on this podcast before. That limbic system is going to drive our reaction to the tinnitus or to the hyperacusis. Yeah. And oftentimes patients who also experience or will also experience tinnitus along with their hyperacusis, and they have to be treated separately.
So obviously there's levels of severity to all of this, right? If the first time you experience something that kind of has that emotional trigger in you and you go speak to an audiologist, theoretically you have a better chance of treating it than somebody who's waited 15 years. Yep. When somebody comes into your practice, whether you have firsthand knowledge of it or not, what are you looking for? How are you trying to diagnose, let alone treat this specific hyperacusis? Yeah, so generally in my practice anyway, I have seen this quite frequently with young kids. Oh, wow. Right? So we're talking about kids that are 9 to 14 years old, somewhere in that range. Mm-hmm. And of course, that's a generalization, but in anecdotally, that's what I've experienced. And the parents will come in and they go, oh,
oftentimes the parents will dismiss the issue,
right.
But the kid's going, no, that is way too loud. It's just too loud. Wow. The TV's too loud. And we'll have patients describe, kids grabbing their ears in just common everyday situations. A car goes by or a truck goes by, for example, grabbing their ears. Yeah. And so the parents are going, I just think they're being a little dramatic in some cases. And maybe they're not being dramatic. Yeah, but typically we're going to discover this at the case history portion, right? We're going to review this history in detail with the patients. So we're going to really dive in or get into the weeds with the patients about what they're experiencing. And those patients are going to be the ones that say, I just feel like everything is so loud. And oftentimes let's say it is the patient that's waited 5, 10, 15 years to talk about this, it has progressed at that point to a point where some of these patients are coming in with hearing protection, right? They come in with foam earplugs in. We're going, it's probably going to be hyperacusis, right? Yeah. And so we have to really approach it from quite frankly, the diagnosis of that is based around a lot more information than testing, because the testing that we have is going to be more along the lines of hearing sensitivity. Sure. But we also are going to be measuring most comfortable loudness levels. We're also going to be measuring loudness discomfort levels. And those patients are clear as a bell. They're going to have very low tolerance levels for loud sounds.
Yeah. And I think that's somebody said this the other day, and it still kind of blew my mind, of like hearing loss. I know this is a little different, but hearing loss can also be a sensitivity to loud sounds too, right? And I don't know where this falls within hyperacusis, but I get it, but it still like blew my mind.
So
right?
So let's try to create a distinction there. So a sensorineural hearing loss, okay, let's just say hearing loss caused by aging, what we would call presbycusis. We're going to talk about it. Fairly normal hearing in the low pitches, starting to slope in those middle speech frequency pitches, and then in those higher speech frequency pitches, we're going to see it drop off, right? And so what we find is what's called recruitment. Okay. So a sound that
not something the military does.
No. We're not recruiting anybody, but the actual the thing that's called recruitment is, let's say I'm the patient with that hearing loss and I have recruitment. What sounds normal to you sounds louder to me.
Interesting.
So what's actually happening is the dynamic range that the cochlea, the organ that's responsible for hearing, the dynamic range that it can tolerate has shrunk. So sounds get louder faster. Wow. It's a type of hyperacusis, but it's not hyperacusis in its true and purest form. Okay. With hyperacusis, oftentimes we're talking about people with normal hearing sensitivity, right? That 9 to 14-year-old kid that I was talking about, normal hearing sensitivity. Everything else medically checks out. They just have a real sensitivity to what they consider to be loud sounds.
And so hit me with treatment options.
Yeah, treatment options. So for patients who have normal hearing, for patients who just have hyperacusis, for example, we need to look at some desensitization therapies, right? So that might involve wearing ear level sound generators, right? And so we need to keep sound moving through that auditory system pretty consistently. Wow. But we're going to start at a really, really basic low level. And we're going to slowly, over the course of, in some cases, weeks, months, we're going to slowly start increasing the volume, right? Or the intensity of that stimulation. And so what it does is it conditions or reconditions the auditory system to handle that amount of sound.
Got it.
And so instead of what we want to absolutely at all costs avoid is overprotecting those ears. We don't want that patient to wear hearing protection unless they're around loud sounds, of course, like real loud sounds, like gunshots and lawnmowers and things like that. But we're talking about normal everyday sounds. We don't want them wearing hearing protection or earmuffs or things like that when they're out and about. We've got to desensitize the auditory system so that it can handle those everyday sounds. And we're going to do that by keeping them in a quieter environment, the patient in a quieter environment, but also controlling the level of sound that's consistently playing in the ears. And in some cases, that might even spill over to tabletop sound generators. And we're going to play that while we're sleeping.
Yeah.
We're going to keep that auditory system stimulated. And then eventually we can kind of transition them away from those ear level sound generators or tabletop sound generators. And now they're just listening to normal everyday sounds.
Got it. Because we've properly discussed hyperacusis, you can now go to Ask an Audiologist for all your audiology needs, including this article today. Dr. Michael Squires, you did a wonderful job.
Thanks.
We'll see you guys next week.
All right, guys. See ya.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.
I was a monster chunk child, so everybody just assumed I wasn't walking or crawling because I just, weighed a metric ton. But then I found that I had fluid in my ears, and so to me it was just like stay on the floor as long as possible.
Yeah.